So what is WHO? WHO is a World Health Organization that was set up in 7 April 1948. It is a United Nations specialist non-political health service based in Geneva, Switzerland. So it's a non-government organization. So it is responsible for leading public health issue, and the WHO works around the world to improve health, keep the nation healthy, and help the helpless. So the aim of WHO is to ensure the universal health coverage and to ensure the health and well-being of billion other individuals. Thank you.
Hello, my name is Hafiz Istihar bin Abdul Fattah. In my part, I will talk more about the Sustainable Development Goals that relates with the World Health Organizations. In Sustainable Development Goals, it has 17 goals, and one of the goals that focus on health is the third goal, which is the good health and well-being. These goals is focused on to ensure a healthy lives and also to promote well-being for all at all ages. It has 13 targets that cover a wide spectrum of World Health Organization's work. The Sustainable Development Goals aims to be relevant to all countries, which is the poor, the middle income, and the rich. This is due to promote prosperity while protecting the environment and tackling the climate change. Before Sustainable Development Goals were adopted by the United Nations in September 2015, there were one of this agenda was called Millennium Development Goals. These Millennium Development Goals were created by the United Nations member states in September 2000. The target of this agenda is to reduce child mortality, improving maternal health, tackling HIV or AIDS, tuberculosis, malaria, and other diseases in 2015. These targets, these goals, Millennium Development Goals, had achieved more in the previous 15 years. However, despite the achievement of the agenda Millennium Development Goals in 15 years, there are some cases of HIVs that are still continue. This is due to the disadvantage of the agenda itself, where the agenda is focused on one small target or specific group of people. Hence, this is why the Sustainable Development Goals are more closely reflect the range of the real world concerns that countries face compared to the narrower agendas of the Millennium Development Goals.
Hello, my name is Muhammad Hazmi bin Helivan. So I'm going to talk about one of the World Health Organization's initiative, which is the Access to COVID-19 Tools ACT Accelerator. As we all know, the world now is facing a global pandemic due to the coronavirus, or known as the COVID-19. COVID-19 is a respiratory illness caused by a novel coronavirus called severe acute respiratory syndrome. The first case of COVID-19 was identified in Wuhan City, China. On 11 March 2020, the World Health Organization declared COVID-19 a global pandemic, its first designation since declaring H1N1 influenza a pandemic in 2009. At the end of April 2020, the Access to COVID-19 Tools ACT Accelerator was launched. It is a groundbreaking global collaboration to speed up development, production, and proper access to COVID-19 tests, treatments, and vaccines. The parties that involved included the President of France and European Commission and the Bill and Melinda Gates Foundation. With that, it brings together governments, scientists, business, civil society, philanthropists, and global health organizations. In conclusion, the ACT Accelerator, launched by World Health Organization and partners, supported the fastest, most coordinated, and successful global effort in history to develop tools to fight disease. That's all from me. Thank you.
Collaboration, Better Health. The Global Action Plan for the Healthy Lives and Well-being for All is another initiative taken by the World Health Organization, otherwise known as WHO. The plan was launched as an effort to support countries over the next 10 years to accelerate the growth towards the health-related sustainable development goals. The plan has a simple premise. Stronger collaboration contributes to better health. So the agencies within the plan, there are at least 12 multilateral agencies. They plan to contribute with the countries all over the world to achieve better health, to achieve health-related sustainable development goals. Now, there are 4 commitments that are built upon by the plan. The first one is engage, the second is accelerate, the third is align, and the fourth is account. The action plan proposes specific actions at the country and global level based on 7 accelerated themes. These themes all mutually reinforce each other. The first theme is primary healthcare. Primary healthcare is an important cornerstone in achieving the health-related sustainable development goals. It mainly focuses on providing an affordable, an accessible, and a high-quality health services for all. The second theme is sustainable financing in health. Having a sustainable financing is important in ensuring that health development goes smoothly. So this theme mainly focuses on those low-income countries who often face financing hardships when it comes to health development within the country. The third theme is community and civil society engagement. By ensuring that the community and civil society is provided sufficient support in what they do, this allows them to stay meaningfully engaged, especially when it comes to policy making regarding health and health responses. The fourth theme is determinants of health. Addressing the determinants of health is vital to creating an enabling environment for health and well-being for all, and ensuring that no one is left behind regardless of their rights, regardless of their gender or their races, religions. The fifth theme is innovative programming in fragile and vulnerable settings and for disease outbreak responses. The Global Action Plan wants to ensure that the health and humanitarian services are available at all times and that they can respond appropriately to disease outbreaks. The sixth theme is research and development. Research and development, innovation and access. As we all know, research and development is an important part when it comes to almost anything, including health-related stuff. So, ensuring that research and innovation is carried out is an important part of the plan to improve the quality and efficiency of health products and service for all. The seventh theme is data and digital health. Digital technologies nowadays allows the health data to be recorded more efficiently, to be collected more efficiently, and to be stored more effectively. So by focusing on improving the digital technology, it allows for the improvement of health data at a better rate. So those are the themes within the themes of the seven. Those are the 7 accelerated themes of the Global Action Plan, and these themes and whatever actions that they propose will be based on these themes. As I mentioned before, all of these themes complement each other. So by ensuring that one theme is being fulfilled correctly, the other themes will be supported strongly too.
Hello everyone, my name is Isaac Henley. I'm gonna explain about 2 programs that have been made by the World Health Organization or WHO, which the programs are related to the Sustainable Development Goals. Firstly is the establishment of Food Safety Unit or FOS. This unit was established to work with member states to control risk of food safety and to respond to accidents and emergencies related to food safety. It also established to help improving the national food safety system, which can be done through promoting the development and capacity of food policy and legal framework, risk-based food inspection and enforcement, food safety information, underpinning evidence, food safety incident and emergency responses, and food safety communications and educations. Next is the regional framework for action on food protection in the Western Pacific. This policy considers the emerging food safety environment and evaluates the approach to improving national food safety frameworks. This involves a heavy emphasis on increasing faith and trust in food safety processes and setting in place strategic steps that develop leadership, relationship, expertise, services, and are important to the development of food safety system. The second program is WHO Special Initiative for Mental Health. This initiative intended to provide 100 million additional people with access to safe and affordable care for mental health problems in 12 target countries. WHO works with member states and collaborates to improve the mental health of residents and of society as a whole. This includes encouraging mental well-being, mental illness prevention, and attempts to improve access to quality mental health services that support the human right of individuals. Other than that, the mental health practice of the WHO cover normative activities and support activities for nations. In more than 110 nations, the WHO has helped develop mental health services through enforcement of mental health policy and regulation, mental health and psychosocial support in humanitarian emergencies, and development and testing of innovative psychological intervention, including digital intervention. Thank you.
So in conclusion, WHO has contributed many things in SDG. While WHO has both advantages and difficulty, it is important for the quality of life and living worldwide. So building up health infrastructure is important not only in the battle against HIV or AIDS, but also in the general advancements of access to quality health service for those most in need. So WHO will continue to supply information that will help the people and also dealing the COVID-19 that attack our country and world nation. Thank you.